Can I welcome you all to this segment, Tackling Obesity, Healthy Food Options. My name is Paulette Hamilton, and I am a councillor in Birmingham in the United Kingdom, covering adult social care and health and public health. I am delighted to be introducing the next speaker today, Shalene Mayhew. Shalene is a registered nutritionist and has worked in public health for nearly 2 decades, setting up community nutritional initiatives and writing national guidance. Shalene co-founded the Urban Food School in 2014 to support the public and organisations and to help them develop culinary skills, which I have had the pleasure to not just attend, but to get involved with, which I really enjoyed. Can I say it was a fantastic, welcoming experience, and I learned a great deal about how to cook different dishes healthily. Shalene is currently a nutrition theme cross-cutting manager for an Horizon 2020 project focused on meeting the challenges of providing European citizens with affordable, safe and nutritious food, creating healthier and more sustainable city region food systems. Shalene joined the Food Foundation as a special advisor on city food policy. She works on the Food Foundation's Global Food Systems Project, founded by FCDO, which was formerly known as DFID. The work will focus on expanding the Bindi partnership to include cities from across the Commonwealth and beyond. Can I say at this point, I have the pleasure Birmingham is actually part of this partnership, and I have the pleasure of joining Shalene and a delegation visiting Bindi in India in July 2018. It was a fantastic experience, as I am sure other participating countries like Bangladesh, Botswana, Jamaica, Malawi, South Africa, and Uganda would say, they would actually say the same thing. Can you please join me in welcoming Shalene Mayhew? Thank you very much.
Thank you so much for such a glorious welcome. I only just discovered that Councillor Hamilton, who happens to be my boss, was introducing me. So what I'm going to do is start sharing my screen so that we can move swiftly onto the presentation. And this is what we're going to be talking. Can we just get a thumbs up, Councillor Hamilton, if you can see the screen?
Yes. Fantastic.
Okay. And I'm going to maximize so that you can only see the screen and not the slides. So what I've decided to do is call the presentation Dietary Inequalities, How is the UK's Black Community Impacted? And just by introduction, there are 2 words that I'm going to use in this presentation. One is obesity, and the other is deprivation. And I have a conscience about using both those words because I think there's a lot of stigma attached to those words. And so what I want to say is that the things that I'm going to share today actually affect the global population. We are all suffering from this crazy situation where the food choices that we're making are not helping us. But what we want to understand is, why is it that certain communities, and today, why is the UK's Black community impacted more than other communities? So this is what I'm going to talk about. Okay, so what do we mean by dietary inequality? So on this slide, I've got something called the Eat Well Guide, and that's a tool that the UK government uses to help the population to make choices, food choices, which will enable them to get all of the nutrition that they need. So everything that we need to be functioning, healthy, thriving children and adults. But the thing that we know through national surveys is that most of us actually don't get the nutrition that we need. Most of us are eating more sugar, fat, salt than is recommended. And in fact, in the Eat Well guide, they've suggested not even incorporating that into a balanced diet. So they've edited the guide. In the past, it used to be a small portion. So you can see there are loads of wedges there, a small portion. So you can eat those foods, but eat them in a small amount. But they've edited it to take it out. It's not necessary to eat those foods as part of a balanced diet. But what we know is that many of us are choosing to eat foods that are high in fat, sugar, and salt. What we also know is most of us are struggling to meet the 5 portions of fruit and veg a day that we require to achieve all of the good nutrients that we need to be the best that we can be. And I work for a fantastic organization called the Food Foundation, and Councillor Hamilton was recently appointed to be a trustee of that organization too. And they have got a fantastic project called the Peas Please project, which is about the UK increasing both supply and demand of vegetables. And they discovered recently that white, Asian, and Asian British groups eat a greater amount of veg on average than Black British, and mixed ethnicity groups. And the sad thing about last year's stats is that white, Asian British groups actually increased the number of veg they eat, but they still fall short of the 5 portions a day, so average of about 3, whereas Black and Black British groups and mixed ethnicity groups decreased, so they're achieving about 2 portions of fruit and veg a day. But before we start passing judgment on the way that our communities are eating and the food choices that we're making, we need to just say that there isn't enough research into why we are making the food choices that we're making. So to start off with, no stigma, no judgment. This is just a situation that we're in and we're trying to understand it. Okay, so why is addressing dietary inequality really important? 1 in 5 deaths globally is diet related. It's quite shocking, actually. In this particular infographic, that's more than tobacco related deaths. And you may see some other infographics where they change that particular picture, but the problem of poor nutrition is affecting us globally, as I mentioned earlier. So our quality of life is being impacted by diet-related long-term conditions, including diabetes, cancer, heart disease, and you heard the previous speakers who I very much respect, both Jenny and David, saying what the impact of those diseases are on the Black community. Our quality of life is also impacted by when we eat and what we eat. So okay, forget the statistics. We all know, based on our own experience, that if we miss breakfast, we miss lunch because we're too busy, something's going to happen to us. Something's going to happen to the way that we feel, the way that we function, the way that we think, the way that we act. But what we don't know is how the food choices that we make are affecting us as individual groups. There's a point I've made at the bottom of those green bullets, which is the evidence between what we eat and how we feel, including our mental well-being and health, is also mounting. And I think that that's going to start changing the way that we implement the kind of research that we do as well. One of the key points for me is that as a practitioner, I'm not a researcher, I'd call myself as a practitioner, so somebody who's trying to encourage change, is that diet-related disease is preventable, not inevitable. We want people to be able to focus on being the best they can be. For that, we need the healthy choice to be the easy and the preferred choice. And for me, the research needs to understand why it's not easy and why it's not the preferred choice. Okay, so why is diet, what we eat, having such an impact on our health status? And even though I don't like to use the word, and there's a director of public health who said that using that word may be contributing to the problem, so that was something that really gave me food for thought when I was planning this presentation. A significant reason is that what we eat and how we live actually is leading to obesity. One of the things that I really want to impress is that obesity is a form of malnutrition. So just because we are overweight or obese doesn't mean we're getting all the nutrition that we require. In the year to November 2019, 62.3% of adults in the UK, people aged 18 and over, were overweight or obese, a similar percentage to the previous year. Black adults were the most likely out of all ethnic groups in the UK to be overweight or obese. 73.6% of Black adults were overweight or obese. Research on why Black children and adults are most likely to be overweight or obese is scant, but PHE and the LGA, the Local Government Association, recently commissioned obesity trailblazer local authorities, and Birmingham is one under the leadership of Councillor Hamilton. We secured this to tackle upstream drivers of obesity. So the question of why the UK's Black community is impacted more than other communities. So if you have a look at, I should have used the highlighter, this chart with lots of blue bar charts on it, where my cursor, sorry, I should have used the highlighter there. So of all, the percentage of people living in the most deprived, 10% of neighbourhoods by ethnicity, this is what this chart is about, it's 9.9% of all of the UK population. It's 15.2% of the Black population, and there you can see it's double for the Pakistani population. It says here, and this is a research think tank, a health think tank in the UK called the King's Fund, ethnic minority groups are disproportionately affected by socioeconomic deprivation, which is a key determinant of health status. This is driven by a wider social context in which structural racism can reinforce inequalities amongst ethnic groups, for example, in housing, employment, and the criminal justice system, which in turn can have a negative impact on their health. Evidence shows that racism and discrimination can also have a negative impact on the physical and mental health of people from ethnic minority groups. And that was only published in February, which around the same time you probably recall, for those of you living in the UK, what the government published about systemic racism. I'm not going to go, because I simply don't have time, but there's a lot to say about this. I'm not going to go into too much depth, but there's also a relationship between density of fast food outlets and deprivation by local authority, and you can see that quite clearly. If, like me, you live in the city of Birmingham, if you go to areas where deprivation is higher and Black and brown people live, you can see the impact on the high street. Can everyone see the, yeah, sorry. The COVID-19 pandemic, I think, revealed a lot. So, I mean, I don't know if it's fair to talk about the Prime Minister and the fact that he was obese and got the disease but is back at work straight away. That's not the result for all of us. And I'm sure even Councillor Hamilton has shared with me some very personal stories about the impact on the communities, the BAME communities. So the COVID-19 pandemic highlighted the impact of deprivation on BAME communities. And one of the most shocking things, and this again has come from the Food Foundation, is that the number of adults experiencing food insecurity by ethnic group increased from 18.3% within the BAME community to 19.7%. So we know that in January, 20% of BAME households had experienced food insecurity in the past 6 months, compared with 9% of white British households. Over December and January, 19% of children of white British ethnicity reported experience of food insecurity, compared with 27% of children of other ethnicities. During the same time period, 11% of white British children or their family had visited a food bank to get food, compared with 16% of children of other ethnicities. We've all lived through the same experience, and we only need to turn to our communities and the people we know to know why they were impacted and why they couldn't afford the food choices that they were making previously. So what kind of change do we need to see? Something remarkable happened in the past couple of weeks. Birmingham City Council, under both Councillor Hamilton and our new Director of Public Health, Dr. Justin Varney, commissioned a whole series of food focus groups with seldom heard voices. Seldom heard voices relate to the communities that are not normally consulted or spoken to when policy is being developed either by national or local government. Obviously, the irony in the city of Birmingham is that nearly 50% of the population is minority group. So it doesn't make sense that our voices are seldom heard. So, but I think it was the week before last, we received some fantastic news. We heard from African groups in the city that they were not entitled to the support of like free school meals or healthy food vouchers because of their immigrant status. So even if their children were born in Birmingham or born in the UK, those children were not entitled to healthy, nutritious options at school or those kind of benefits that you would get if you're on a low income. And I looked up the lawyer who had won this case, which challenged the Secretary of State. And now this is going to go to the higher courts. I forget the legal terminology, which is going to challenge the Secretary of State. And this is what she said. It is an unfortunate fact that children from low-income families and those of BAME backgrounds are more likely to develop poor nutritional outcomes due to the lack of nutrition they receive at a young age. This can impact their health, development, and well-being throughout childhood and in later life. The scheme, the Healthy Start scheme, was intended to address these issues and help eliminate food poverty and health inequalities. But by excluding families like our clients, this has had the opposite effect and discriminates against poor children based solely on their parents' immigration position, leaving thousands of economically deprived children and mothers without access to vital vitamins and nutritious food. The early years in life are absolutely key to how we as adults will be. And so we need to make sure that everyone, regardless of their income, their background, their socioeconomic status, has the best access to nutrition. And again, the Food Foundation has set up this Children's Right to Food campaign, which with other civil society organizations, we are fighting for food to be a basic right, good food, nutritious food. Let's move on. What is the national government doing to tackle obesity and nutrition-related issues? So we heard that after Boris Johnson came out of hospital, he really wanted to get on the programme, start tackling these issues, and he aims to halve obesity by 2030. He's going to introduce a new campaign for healthier weight and expand weight management services. I would say as a practitioner, in order to engage those diverse communities in these cities, we need to understand how those weight management services will be effective within diverse communities. And I've got some examples later. The UK government is also going to gather evidence on the effectiveness of the traffic light system, which is basically the label on food products, which tells you whether a food should be eaten copiously, lots of it. So if it's spinach, have as much as you like, or if it's a donut, then maybe restrict it. Red, that's a red, it's high in sugar. So is that effective, or are we confused? For example, when I do like healthy eating presentations to parents, they're often confused by drinks like fruit shoot, which doesn't really contain fruit, but it contains high sugar, but they're giving it to their kids. They're also going to encourage out-of-home food businesses to calorie label. And this is interesting because it's only the businesses that are over 250 employees. So McDonald's counts, but say, for example, some of the smaller restaurants on our high streets won't count because they don't employ 250 employees. They're going to consult on the calorie labeling of alcoholic drinks because many of us don't realize how that's contributing to our weight. And they're going to end promotion of foods that are high in fat, sugar, and salt. I think they're also consulting on that as well. So you won't necessarily see a 2-for-1 offer when you walk into a supermarket. One of the things they're definitely going to do is now ban advertising of high fat, sugar, and salt foods before 9 p.m., which is all very good. What is the local government, so Birmingham City Council, going to do to tackle obesity? And this is all under the leadership of Councillor Hamilton. And I have to say that I've been working as a public health nutritionist in the city for, as she says, nearly 2 decades. And without Councillor Hamilton, right now, this work would not have been going on. She really ensured that it would continue. So under her leadership, we aim to transform Birmingham's food system. And we're starting out by consulting the communities. So obviously, Councillor Hamilton has great experience of this herself, and you only need to see her Facebook page to see how she's doing this all the time. We've also won some major research projects. So that includes a UKRI project and a Horizon 2020 project, which is a European funded project, which aims to look at what is it that we can actually do? What are the levers that we can test to transform Birmingham's food environment? With the Horizon 2020 project, which I am involved in, we're going to be setting up a living lab and funding pilots. One of the things that the city decided to do was to join the Milan Urban Food Policy Pact, and we've recently been elected onto the steering group of that organisation, the Milan Urban Food Policy Pact steering group, to represent other European cities. And the fantastic thing about that is that we have a Black leader who's also going to be advising other European cities about how to engage their diverse communities. And even though we sometimes look at our situation here in the UK, we know that it's much worse elsewhere. So there's a lot of learning to be done. As a result of the COVID-19 pandemic and under Dr. Justin Varney's leadership, we're going to be publishing an emergency food strategy because we know it's not over. More of our communities and the Black community are facing food insecurity, and we need to provide support. We're also in the process of developing a healthier, sustainable food strategy, which will go out to consultation over the summer months. But obviously now is the time to input. We're piloting a calorie labeling tool for Birmingham food businesses. So despite what the UK government's doing, we're trying to figure out a way of encouraging the many SMEs, the micro businesses that Black communities and other communities are setting up, because quite frankly, there's so much of a barrier to employment. This is what we do. And we've also set up a Healthier Food City Forum where we're engaging other stakeholders to drive change in the city. But the truth is that it's not going to be enough. And actually, the Black community as well is really active in the process of making this change. And this is what I want to end with, is what is it that the community is doing itself. And so I'm going to introduce you to some change makers to end on a really positive note. Marcus Rashford, who I think at 2 p.m, oh, he's already kicked off, 2:18 it is, will be playing in the England team against Croatia, and I think it's called the Champions League, has done some remarkable things. And I think most of you will know is that he caused the government to do a U-turn around free school meals, and he is now on a mission to end child food poverty in the UK. And that's just an incredible starting point in terms of making change happen. There's also an organisation which I've really been intrigued by and I think is really exciting, called Land in Our Names, which is all about reconnecting Black communities with land in Britain. I don't know, last year I started listening to, whilst I was in lockdown, Radio 4 a lot. And I like going into the countryside for walks, and I was constantly hearing this banter about BAME communities not going into the countryside. And I thought, what are they talking about? But there is this really important thing of having a strong connection with land and actually owning land, obviously, but farming and reconnecting with where food comes from in order for us to change our relationship with food. So it's definitely worth checking out this group. And this farmer, I'm sure a lot of you have met him, is actually from Small Heath in Birmingham, and you can actually buy his food on Ocado. So he called himself the Black Farmer because that's how everyone else referred to him. For me, a lot about tackling obesity and the food system is about, tackling obesity is about having a positive relationship with food. And so these are quite good examples of this. Riaz Phillips is an LSE, I think, an Oxford graduate, and changing the narrative. So one of the things that I have a conscience about being a public health practitioner, being around people who constantly use the phrase BAME and who talk about us having the highest rates of obesity, diabetes, and poor education, poor life outcomes, is we're creating a narrative. And yesterday we had a This Is My Opinion session where a lovely lady called Dr. Alia Goyal, who's a GP here in Birmingham, said that actually people are beginning to see, children, not people, are beginning to think that that's their reality, that we're going to get to diabetes. So Riaz Phillips and a lot of other food activists are changing that narrative by revisiting their cultural heritage. So this is an amazing cookbook for people to buy into. And it was published actually because of the impact of COVID-19 on BAME communities. And here's one of my favorite change makers, Councillor Hamilton herself. So Councillor Hamilton decided to really include food policy as one of her key areas of concern for the city. So she's also the cabinet member for health and social care, very, very powerful portfolio, and one of the largest in Europe, and has recently been elected to the Milan Urban Food Policy Pact steering group. And that's where we're going to be able to make change happen, because it's cities that are committed to transforming food environments. And it's also really fantastic to see a powerful Black politician leading thinking in this area. I also happened across this dietitian who really takes developing culturally sensitive programs to the next level. I'm sure when you saw the Eat Well guide, everyone was thinking that needs to be adapted. But here, this lady, Shola, set up Food for Purpose, and it's actually a faith-based campaign, and she's based in Southeast London, and she said many of the African communities that are moving into Southeast London, and it's one of the fastest rates of growth in terms of population, are churchgoers, and actually they respect church leaders more than health professionals. And she's developed this fantastic program which is going to support them with their food and health choices. I also know this fantastic young man. I have a cooking school, which is where I'm sat today. I'm not going to move the camera around because but you can see in the first picture, that is the cooking, part of the cooking school. And Omer has developed the Sudanese kitchen, and we booked him to teach about the cultural influences on Sudanese food. And when I was researching what he's been doing since he came, there's actually a program on CNN, so African Voices and Change Makers, about how he's teaching about food from Africa or Sudan and the influences on it. And I think that's really important as we move forward with our own narrative. So narratives that we're constructing and not people like me constructing for others. And that also relates to the changing picture in the UK, which is fantastic, about our culinary food experiences. And there is a rise in Caribbean and African food experiences. And that, I think, is going to help build a better picture of something that we can attach ourselves to if you are Caribbean or African. And also so that you're not under the influence of messages, negative messages from the wider world. So transforming our food environment, how can you be connected to food and fresh food if you have McDonald's in front of your face, is all about, I think, the change makers in the community, and not necessarily the little bit of research which is telling us we are the fattest or we're most likely to have diabetes or heart disease. And there's a fantastic video on Vice. Vice is a channel for young people. I'm not young. And it's about trying to eat healthy in a food desert. If we know that the rest of the world is going to struggle to keep up with the change that we want to see, that there are some changes that we need to make ourselves. And I'm going to leave it at that because I'd like you to visit that video, and then maybe you can share your thoughts after. I think I'm on time. Yes, I think that's it. So I'm going to escape from the video. Shall I stop sharing? Yeah. And over to anybody with chats, questions. Let's have a look. Have we got any questions? Q&A. I've got 4 questions. What is the impact of food deserts in the UK? Great work, Dr. Varney and Councillor Hamilton. That's great. Please can you send me some information about the new projects in Birmingham? I will make a note of your email. Thank you for a great talk. I just wanted to express caution regarding calorie labeling. This can be highly triggering for those with experiences of both clinical and non-clinical levels of disordered eating. That's really interesting because I think that actually that was covered recently as well. Thank you so much for all of those comments. So in terms of food deserts in the UK, okay, so we are, we've called them fat swamps as well. In Birmingham, for example, we've tried to restrict expansion of fast food restaurants. And unfortunately, a lot of people say already saturated, that actually there's no point in restricting because we're already where we don't want to be. So the mood now from the council is, what is it that we can do to incentivize or encourage people to make healthier, more sustainable food choices? I think, yeah, sorry about that. I was just seeing that it disappeared. I don't know if I'm still on, actually. I've got 3 more minutes. Okay. So the impact of food deserts, I would say, is that it is having a negative impact on people's food choices and contributing to obesity, as it is everywhere. And we need to do much more to ensure that those, especially the most vulnerable, have access to all the nutrients that they need. And that's something that our policy work is looking at. So there's an organization called Sustain and Sustainable Food Places that's really forcing, they've set up a framework in the UK that's really forcing us to think about this. I will definitely pass on the comment to Dr. Varney and Councillor Hamilton about your positive feedback. Please, can you send me, okay, sorry. And then the final thing, yeah, so this is so interesting, the calorie labeling, because it was covered recently in a session on Radio 4, in fact, the news in the morning. It's really difficult. I don't know how to answer that. And I think that we need to probably do some consultations. And I think even at the UK government level, there will be consultations before they decide to move forward. New York City ages ago decided to start labeling. But if it was possible for you to feedback, I'd like to get your thoughts on that too. My thoughts are, especially with the pilot that we're doing in Birmingham, is that let the businesses know first and see if that they can modify recipes to make them healthier. So these are the small businesses. So even if we reduce salt, for example, by small amounts, it will have a dramatic and positive impact on salt consumption in the population, and like the worst impact of over salt consumption, which is like stroke. So I think, I hope I've done justice to your questions. Let's see. Thanks, excellent work from Paul Mills. I appreciate that. I think there's a lot more work to do. And I'm really aware of the fact that we need a lot more resource. And we definitely need to see more Black. I want to be able to report to more Black and BAME professionals in this area. I hope that's okay. I'm going to be logging off now. Okay, so thank you, everybody.